Epidemiology and Control of HIV/AIDS in Eswatini. Tragically, HIV/AIDS continue to be the leading cause of death in Eswatini. Eswatini has the world's highest prevalence rate, estimated at 26%. In 1986, the first case of HIV was reported in Eswatini, marking the beginning of a significant health crisis. There was an explosion of cases and waves of death. A health emergency was declared in 1997. Recognizing the urgency of the situation, the government of Eswatini made efforts to expand HIV treatment and prevention services in 2011. The government goal was 95% of people would know their HIV status, 95% of those with HIV will be on an antiretroviral treatment, and 95% of those receiving treatment will have a suppressed viral load. These initiatives yield positive results with a notable decline in HIV incidence. However, despite this progress, the incidence rate remained higher among women compared to men. In 2011, the rate stood at 3.16% for women and 1.83% for men, while in 2016, they were recorded at 1.76% for women and 0.86% for men. Effective surveillance of HIV is crucial for monitoring epidemic trends and assessing the efficiency of the country's response. In order to target interventions effectively, it is essential to prioritize high-risk populations. A vital component of HIV surveillance is widespread HIV testing, as emphasized by the World Health Organization. By implementing comprehensive testing measures, countries can gather accurate data to inform their strategies and ensure that resources are allocated appropriately to combat the spread of HIV. Here's a population breakdown occurring between 2011 and 2016 and provides the rates of women and men in Eswatini between those 2 years. The collection of surveillance data in Eswatini has been facilitated by the implementation of the Eswatini HIV-1 Recent Infection Surveillance Program, which is also known as EHRIS, which was launched in July 2019. The results obtained from this data analysis revealed a concerning trend, with women aged 15 to 24 accounting for nearly half of all new HIV infections. These findings underscore the urgent need for target interventions and prevention efforts among this particular demographic group. Adolescent girls and young women face significant risk of gender-based violence, which put them at most vulnerable situations. This group has reported encountering obstacles such as limited access to preventive services and a lack of condom availability, particularly exacerbated during the COVID-19 pandemic. Various factors contribute to these challenges, with young women citing multiple sexual partners, inadequate knowledge about sexual and reproductive health, early engagement in sexual activity, school dropout rates, and low condom usage as primary drivers. The presence of gender-based violence further complicates matters, making it difficult for these individuals to engage in safer sexual practices or utilize preventive measures such as PrEP. Additionally, victims may also experience fear when it comes to discussing sexual issues with their partners, further impeding their ability to protect themselves. The spread of HIV in the 1980s and 90s was closely linked to migrant workers employed in South African mines. Due to cultural norms that discourage premarital sex, these workers had limited access to education and knowledge about safe sexual practices. Furthermore, individuals residing in rural areas had significantly less information about HIV/AIDS compared to their urban counterparts. This knowledge gap was particularly prominent among economically disadvantaged populations. Vulnerable groups such as female sex workers, men who have sex with men, and transgender individuals face additional barriers to seeking testing and treatment, primarily due to legal constraints. Members of the LGBTQ community expressed concerns about their lack of rights, criminalizations under laws like the Sodomy Act, and the absence of effective communication and education regarding HIV/AIDS. These factors combine to create significant challenges to addressing the HIV epidemic among these marginalized populations. In the neighboring countries of South Africa and Mozambique, the impact of HIV/AIDS is particularly severe, with high death rates attributing to the disease. Within South Africa, HIV/AIDS accounts for 28.5% of the total deaths, while in Mozambique, it contributes to 24.2% of the mortality rate. Several key factors are associated with the transmission of HIV. These factors include a low rate of male circumcisions, engaging in multiple sexual relationships, low condom usage, and early sexual debut. Eswatini faces various barriers that affect both high-risk groups and the country. The country has traditionally been a male-dominant culture, resulting in discrimination against women and the denial of their basic rights. In many cases, female planning decisions are made solely by men, limiting women's autonomy. Shockingly, UNICEF reports that 1 in 6 girls aged 13 to 17 has experienced some form of sexual violence. Furthermore, another high-risk group facing barriers in Eswatini is men who have sex with men and transgender individuals. The outdated Sodomy Act criminalizes same-sex relationships, leading to discrimination and stigma. Although the law is not consistently enforced, the discrimination persists. These stigmas and societal attitudes towards sexual behaviors and gender identity can impede the effectiveness of HIV prevention and treatment efforts. In particular, the stigma surrounding sexual behaviors may hinder the formation of stable couples, increasing the risk of HIV infections. Such challenges highlighting the need for comprehensive approach to address these barriers and promote inclusivity in Eswatini's HIV prevention and treatment strategies. To address morbidity and mortality rates, Eswatini provides free antiretroviral drugs to its populations. Despite the high level of access to HIV treatment, the country faces a significant challenge regarding non-adherence to medications. Several barriers contribute to the lack of adherence, including medication side effects, stress, excessive alcohol consumption, and forgetfulness. Polygamy is another factor that poses challenges to adherence. Individuals involved in polygamous relationships often feel compelled to hide their HIV status due to fear of rejection and social exclusion. This fear further complicates their ability to adhere to their treatment regimens. Addressing those barriers to adherence is crucial for Eswatini efforts in combating HIV. By providing support and interventions that tackle medication side effects, stress management, alcohol misuse, and forgetfulness, as well as creating an environment that promotes acceptance and support for those in polygamous relationships, Eswatini can improve adherence rates and enhance the effectiveness of HIV treatment programs. Eswatini has made a remarkable progress in its efforts to mitigate the impact of HIV/AIDS within the country. They have surpassed many nations in terms of testing citizens, raising awareness about their HIV status, and providing antiretroviral treatment. However, despite these advancements, the country still grapples with challenges stemming from the traditional practice that do not align with Eswatini's HIV/AIDS programs. The persistence of stigma, gender-based violence, and political implications pose significant obstacles that must be addressed to effectively combat the detrimental impact of a potential future wave of an epidemic. Resolving these issues is crucial for Eswatini to achieve comprehensive success in its efforts against HIV/AIDS. By tackling stigma, addressing gender-based violence, and ensuring political support, the country can strengthen its response and further diminish the impact of the disease. To combat the HIV/AIDS epidemic in Eswatini, a comprehensive community-based education and awareness strategy that focus on rural areas can be highly effective. This program will address the communities with limited knowledge of the disease and those most impacted by the epidemic. The strategies would include the following key components: educational campaigns, peer support groups, community involvement, and open discussions and breaking stigmas. By applying this comprehensive community-based education awareness, Eswatini can effectively address the HIV/AIDS epidemic in rural areas. It would equip individuals with the necessary knowledge and support of behavior change and foster a community environment that encourage open discussion and acceptance through their efforts. The country can make significant progress in controlling the spread of HIV/AIDS and impacting the lives of those infected.